Good afternoon. I'm Dr. Jonathan Fielding, the Director of Public Health and Health Officer for LA County, and I'm joined by a number of experts from our department. I want to thank all of you for being here today to help us accurately inform all our residents about the recent cases of meningococcal disease in our county. Let me begin by offering our deepest condolences for the families and friends of the individuals who recently succumbed to this disease, and also to be very clear that we really sympathize with the heightened concern related to meningococcal disease. Today we want to make sure that residents have accurate, timely, complete information on the disease in our county to help them make important personal decisions. And we hope that by sharing what we know, we'll alleviate some of the anxiety that has surfaced over the last several days. As some of you have already learned, meningococcal disease is an infection of the lining of the brain and the spinal cord. The infection is caused by a bacteria, Neisseria meningitidis, that can be spread by very close contact with an infected person, either through exposure to droplets that result from sneezing and coughing, or through direct contact with the saliva or mucus. This can occur during kissing, sharing a bottle, a glass, sharing utensils, sharing food, sharing cigarettes, or even smoking alone. Now, while many individuals can carry the meningococcal bacteria in their nose and throat and not be sick, a very small number get very serious symptoms: a high fever, a stiff neck, altered mental status, confusion, rash, severe headache, low blood pressure, or generalized muscle pains. And anybody who believes they've been exposed to a person with meningitis should not wait to see if these symptoms appear, but should get themselves immediately to a physician to obtain preventive medication. We have good preventive medication for those that have been exposed, and it's in the form of antibiotics. Now, meningococcal disease is a reportable disease, which means that hospitals, physicians, laboratories, all are required by law to immediately report every case of meningococcal disease in the county to the Department of Public Health. Currently, the reported number of meningococcal cases has not met the Center for Disease Control and Prevention criteria to be defined as an outbreak in Los Angeles County. It's important to note that the incubation period for meningococcal disease, the time from which you get the infection to the time you show symptoms, is between 2 and 10 days. Given this short window, confirming any link between cases requires substantial analysis. By weekend, the department should be able to confirm whether this most recent case is linked to the cases in Chicago or New York City. According to the Centers for Disease Control and Prevention, a meningococcal outbreak has 2 criteria. 1, 3 primary cases within 3 primary linked cases within a 3-month period, and 2, an annual rate of disease greater than 10 per 100,000 in the population. The level of cases reported recently does not approximate outbreak threshold levels, either among gay men or in the general population. Let me be very clear, this is not a gay disease at all. It's the behaviors that predispose individuals of either gender to this disease. So what are the behaviors? You know, intimate contact with a lot of different people, even though it's not sexually transmitted. Sharing bottles, water bottles, whatever, if you happen to be at a dance and sharing things. Smoking, or being even exposed to secondhand smoke.
But forgive me, this is not a gay disease, but yet you have no, wait a minute, because this is...
I'm following up on my question. One moment, please.
I know.
I just like that, if you could just explain, though, why does it seem like in this case that the gay population is the one being hit?
I think we're trying to ask the same question. Who are these other 9 people? But how come you are so concerned, rightfully so, with one population? Tonight, when my people see TV, they're going to wonder, well, wait a minute, Who are the other two dead?
This is a sporadic, rare disease. There's nothing specific about the population, about those 9 others that I could characterize.
Because it's communicable. It's a contagious infectious disease.
This is a contagious disease. The good news about the disease, if there's any good news, is that it's hard to get, in the sense that it is not nearly as contagious as, for example, influenza or the common cold. It takes, close contact or sharing of implements in order to transmit this, as opposed to some other diseases where you have aerosolized virus, for example. And this is a bacteria. It's not sexual orientation that causes risk. It's behaviors that cause risk. So that's the issue, and we need to, again, learn a lot more because we're early in our understanding of that.